Welcome to the Vertigo Recovery Doctor. I'm Dr. Kevin Smith, vestibular physical therapist, and I'm going to be talking to you about the different types of BPPV. So when people talk about BPPV, a lot of times they wake up and they experience this spinning sensation, usually lasting less than a minute with positional changes. And BPPV stands for benign paroxysmal positional vertigo. And this condition is the most common reason for vertigo, and it's the most easily fixed most of the time. Sometimes you get complicated cases of BPPV or more than one canal involved, and so we'll kind of talk about the different types that you may encounter. But the first and most common is in the posterior canal. So if you go over the vestibular system, you have three canals in the vestibular system. So each system has three canals. You have the posterior canal, which is where BPPV happens the most often. And then you have the horizontal canal, which there was a study that came out that said almost 50% of the time it may be in the horizontal canal. So it may be there more often than we previously thought. And then you have the anterior canal, which is kind of debated whether or not BPPV actually occurs in the anterior canal, just based on how it's oriented. If they get kind of displaced in that canal, a lot of times it just may drop back down into place. So most of the time we're looking at the posterior and horizontal canals. And so three canals on each side, you can have those little crystals displaced in any of those canals, which is why one maneuver that might have worked for somebody else you knew doesn't necessarily work for you. And if you're not experiencing, if you don't have BPPV as the cause of your vertigo, then Epley maneuver may not work at all. So if you have vestibular neuritis or vestibular migraines or 3PD or cervicogenic dizziness, the maneuvers aren't going to help. So that's why it's important to figure out what the cause of your vertigo is. And you can find at my website, vertigorecoverydr.com, you can get my ebook on the 5 most common causes of vertigo and what you should do for them. You just sign up for my email list. So let's get into it. The posterior canal, let's start there, because most often is what I see most often is where that BPPV is displaced. Now, you can have either those little crystals floating in the canal, and we call that canalithysis, or they can be stuck to the structure at the end of the canal called the cupula. Now, this cupula is this little structure, and it has, sometimes those little crystals get stuck, and requires a different maneuver to knock those crystals off of it. So you can have canalithysis, where it's floating in the canal for the posterior canal. You can have it floating in the canal for the horizontal canal. Theoretically, maybe the anterior canal. Or you can have cupulothysis, where it's stuck to the cupula at the end of the canal in the posterior, horizontal, or theoretically, maybe the anterior canal. So the most common is that posterior canal. You're going to be doing that Epley maneuver or modified Epley maneuver to get rid of that, depending on which side it's on. That's just feeding those little crystals around the canal and putting them back where they're supposed to belong. Now, if it's stuck to the cupula, you have to do a different maneuver to knock it off of there. And then sometimes that fixes it. Sometimes you have to do the modified Epley because you converted it from being stuck to the end of the cupula to now floating in that canal. And so sometimes that requires 2 maneuvers, and that's when it gets a little bit more complicated. Now, I'd say it gets even more complicated when it's in the horizontal canal. Now, a lot of times what I see is that people, sometimes you can get it displaced in the horizontal canal, but a lot of times people will try doing the Epley maneuver, and when they're going from their head rotated to, like, let's say they have it in the left posterior canal. If you're going from your head rotated to the left, and then you go to rotate it to the right, and you lift your head up, a lot of that can cause a conversion from the posterior canal to now those little crystals floating in the horizontal canal. And so a lot of times when people tell me, oh, I tried the Epley maneuver on my own, and then now I test them, I see in the horizontal canal. Sometimes I'm thinking, okay, well, maybe they lifted up when they rotated back. So if you're doing that Epley maneuver, make sure you keep your head backwards and you rotate with your head still extended, so that you avoid converting it into the horizontal canal. So in the horizontal canal, Sometimes it can be a little bit tricky to determine which side those little crystals are in. Now, you have it floating in the horizontal canal, or again, you can have it stuck to the cupula at the end. And it's the same kind of thing. If it's stuck to the cupula, you have to knock it off. Sometimes that maneuver fixes it. Sometimes you have to go through another maneuver to move those crystals around the canal and back where they're supposed to go. Now, if you're trying to figure out where your crystals are and where and how to reposition them, you can check out, if you go to www.vertigorecoverydr.com/what-is-BPPV, you can sign up and get my Vertigo Kickstart course that guides you through this on which canal may be involved, where the crystals might be displaced, and what the best maneuver is to do for it. If you have any questions, feel free to reach out to me at hello@vertigorecoverydr.com. But yeah, check out my website and sign up for that course. And I'd love your feedback on it as well. And hopefully that's helpful for you to kind of figure out where those little crystals are and how to put them back. I wanted it something for people to have access to right away, to help reposition their crystals when they need to, because it's a lot of times it can be an easy fix. Now it can get a little tricky and complicated when they're what we call a canalith jam. So sometimes if there's a narrowing in the canal of the vestibular system, and those little crystals are displaced and they get jammed in there, that can give us some funny eye movements, and it makes it really hard to determine which side those little crystals are and which maneuver might be the best one for you. And again, sometimes you have to do a little bit faster maneuver, a different type, to knock those crystals out of place and get them floating in the canal before you can do that repositioning maneuver. And the other thing is that sometimes you can have more than one canal involved. So, I've seen patients before where they had both posterior canals and both horizontal canals involved. And we had, it took us 2 sessions because they started to get a little bit nauseous with doing the repositioning maneuvers. But eventually we got all the canals resolved, and they're feeling better after that. So couple things to look for. You can have those little crystals floating in the canal, and we have to just feed them around to get them back where they're supposed to go. You can have them stuck to the cupula, which we got to knock them off, which we call cupulolithiasis. Or you can have multiple canals involved, and sometimes you can have a little bit narrowing in the canal that gets those little crystals stuck. And sometimes when I'm testing people, they have symptoms that tell me, we're looking for this kind of ramping up of symptoms, and then it kind of peaks and then it ramps back down with intensity. And I'm looking at the direction of their eyes. Sometimes I see no eye movement, but their symptoms kind of match that pattern of kind of going up, peaking, and then coming back down. And I'll treat them for BPPV, and it'll resolve their symptoms. Sometimes those little crystals are just a little bit closer to the wall and not providing enough drag to stimulate out that eye movement, and but it's still there causing symptoms. So sometimes BPPV can be a little bit tricky. Sometimes or I should say most of the time, it's pretty straightforward. So, if you having symptoms with positional changes, laying down, rolling over, looking up, looking down, bending over, and it's lasting less than a minute, make sure you rule out BPPV, because a lot of times it can be a quick fix. If you're having trouble with it, definitely go see a vestibular specialist. Check out my course, and let me know if it was helpful for you. I hope this was educational and helps you out in trying to figure out what's going on with your vertigo. Let me know if you have any questions. Reach out in the comments below, and I'll post those links below as well. Thank you for watching.